Herzlich willkommen bei Sunekos Deutschland. Mein Name ist Astrid Tomczak. Ich freue mich, dass ihr wieder mit dabei seid. Heute geht es um Sunekos Cell15, das Produkt für die oder gegen Cellulite. Ich freue mich, dass ich heute wieder einen Gast bei uns habe, Dr. Epps aus London. It's been a while since we spoke last time. So happy to have you again.
Thank you.
And today we are speaking about Sunekos Cell.
Yeah.
Cell15 to be precise. Yeah. So we are speaking today about Sunekos Cell15. This is a product that is gaining quite some interest because cellulite is a big problem.
Of course.
And 80 or 90% of the women, I'm not
I don't know
sure.
the figure, but it's a lot.
Yeah, it's a lot. It's almost everyone that is concerned. So what is your experience with the product first?
So again, just like the rest of the range, I've been using it probably about 3 years. I tend to think that most of my patients who I've done it on, I don't think, probably nearly all the patients I've used it on, before I used it on them, they didn't know that there was an injectable to actually treat cellulite. There are products on the market which are used for cellulite, but are they treating cellulite? That's a different thing entirely. You may find products, for example, based on, let's say, polylactic acid. That's not treating cellulite. That is simply trying to mask the problem. And that's why the medical indication has been granted to Sunekos Cell. I believe it's the first product to have that for Cell, if I'm not mistaken. I take it back if that's wrong. But when you look at, say, polylactic acid products, they are not treating it. They have no on-label medical indication or medical license at all, because treating it, as you may find out today, is completely different. Treating it means you are hitting the root cause, which you are not doing with other products, which is why I think Cell is so unique, actually.
It's interesting because you are talking about a medical indication. So normally when you think or speak about cellulite, it's seen as an aesthetic problem. It's an aesthetic issue. So it's not looking nice. So you want to do something.
Correct.
But hardly ever is someone speaking about it as a medical thing. So what is so medical in cellulite?
Well, I think it's both. You know, as far as the patient is concerned, it's an aesthetic problem. As far as someone who's interested in the biology, it is a physiological problem. We can call that a medical problem. And so part of this treatment, I think, is actually to translate the aesthetic to the medical for the patient. And when you do that, you realize actually, if you wait to treat this, it's going to get worse, and it's actually much harder to treat. And there comes a time when it's beyond the scope of this product, because you enter a stage of cellulite which has sclerosis of the blood vessels, and you can't do it at that point. But I think as long as you're willing to explain the translation from aesthetic to medical, you'll be fine. And how do we do that? Well, we have to explain that part of the reason cellulite looks the way it does is because of the dysfunction, the cellular dysfunction. And we find that, you know, inflammation, acidosis, these are key factors amongst others, which play a role. And the protein structure, the architecture in that tissue is not what it should be. Hence why the appearance, therefore, is not what it should be. And once you understand that, then you get why actually, it is a bit of a medical problem. Because saying the protein isn't right, saying the inflammation is there, the acidity is there, if you didn't know we were talking about cellulite, you'd probably have thought we were talking about some medical condition. And yet this is what we're talking about, cellulite. And so that's why it's a medical problem. There are physiological factors at play, which we are actually treating the root cause of with Sunekos Cell, but not with something, just for example, say polylactic acid, as an example.
Why are mostly women concerned?
So there is a part to play in terms of hormones as well. I don't think anyone understands it perfectly, because I think nutrition is also a big player in that, and the rate of fat storage, not the amount of fat intake, which is completely different. The rate of fat storage, I think, is really key. And so we just generally find, as a result of both those things and other things, that it's much more likely to be found in a woman than on a man. Doesn't mean that it's any more difficult to treat. The treatment is still the same, whether it's a man or a woman. It's just that we find demographically they're more likely to be concerned. But unfortunately, as I said, they're not fully aware there are ways to treat this. Even radiofrequency doesn't actually treat it. It just tries to coagulate the skin, causing as much damage as possible to hide or mask the problem. There's no root cause being treated there at all.
I understand that this is a problem that has many factors that come into play. So that's what we see here on the legs or on the back, or is just a result of that.
Yeah.
Is that
So
your view as well, or?
I think, yeah, so you see that due to all the factors, which you've only mentioned a couple of today. And if someone wants to ensure cellulite does not return, part of the treatment isn't just the injections, it's education for the patient. Because getting rid of it can be done. It's actually not that difficult, as I'm sure you've seen with these products. But getting people to understand how to stop it coming back is another thing entirely.
That is the point.
Yeah. Now, if you use this product, you will get rid of it. But if it comes back, it's not because the product didn't work. It's because the things that are causing it, you still haven't addressed. So like, for instance, if you go to the gym, you get very fit. If you stop going to the gym, you're not going to maintain that for the rest of your life.
No.
Like, you've not addressed everything. And it's the same with this. If you treat it and then suddenly you go back to eating 8 KFCs a day, every day, I mean, let's be honest, it's going to come back. Right?
Yeah.
And so there's a level of being sensible, and that is part of the treatment, the education as well as the injections, in my opinion.
How do you educate your patients?
So I'm in a very fortunate position in that when patients come to me, they come to me after having been educated. It's not that they come and then I educate them, which I know is not common, and from everyone else it's typically the other way around.
Yeah.
This is because patients have usually watched 10 hours of my YouTube before they come, which saves me a lot of time in clinic. But typically, even before I got to that stage, there would be a case of, in this product, in Cell, the education actually comes first in terms of even before the inquiry of the treatment, because typically they're there for something else, not knowing there's an injectable for cellulite. And while I'm treating something else, let's say Sunekos in the face, and they say, this is great, where else can I do this? I say, we can do stretch marks, we can do laxity on the body, we can do cellulite. Oh, you can do cellulite. And the education immediately starts. So for me, that's the way to do it. But right now, the way I work, because of the social media that I use, it's not something I have to worry about. I'm very fortunate and lucky to have that.
What would you say are the, let's say, 3 to 5 key factors a physician should inform the patient about when it comes to a cellulite treatment with Cell15?
So I think if you are willing to, between sessions, apply some massage, that does help because that increases the blood flow to the area, which we need. Be it something the patient does at home, maybe with a massage device, or a professional massage, either or, that's great. And they want to get some movement in as well to try and, again, improve that blood flow. That's why typically cellulite tends to look a little bit better at the end of summer rather than in winter. And if they can also ensure that they get good amounts of sunshine on their body, on that area, you need the vitamin D for the good production as well, for the good function of the area, As well as that there are nutritional factors at play, which is a 10-hour video by itself. But there are nutritional factors. I'll just leave it at that for today. And we want to try and optimize that as much as possible. And then when it comes to the actual treatment, we ideally want to use something like a cannula for Cell, in my personal opinion. That's all. And the reason I say that is because when there is a lot of inflammation, multiple injection points will add to that inflammation. Whereas if you have a single cannula entry and you just fan the area, a little bit less injections, and so there's less inflammation as a result immediately post-treatment. So I think that's better. But the clinician has to be competent at using a cannula. What you see in this area of wherever the cellulite is, a little bit of tight tissue. Fibrosis is what it is. And if you're not experienced, trying to get a cannula through fibrotic tissue, it's not easy at all.
It can also be very painful to the patient.
It can. So that's a key factor which, you know, I can't simply say some advice on and suddenly they've got it. That's clinical experience.
Yeah.
So those are, you know, 5 key tips, I would say, to get good treatment results from this.
When we look at the product itself, so there's for sure a difference to the other products in the range. So what is the difference? What are the ingredients?
Sure. So in terms of the amino acid structure, the same. The weight of the hyaluronic acid is the same. But we have an additional vial, if you like, and these are carbonates and bicarbonates. And the reason we have this is because that is our tool, without going into too much chemistry, which if you do the training, that's part of it. But just to give an introduction today, that's the tool that we use to really minimize and practically zero the inflammation very, very quickly. Once we reduce that, then the active ingredients, the HA and the amino acids, they can actually get to work.
Yeah. So it's a completely different, let's say, idea than you normally see on the market, because normally you're working with lipolysis treatments, or you think, okay, you do a liposuction. So you are working basically on the hypertrophic fat cells, not so much on restructuring or curing the area.
You're working on multiple cell types in that area, and you are restructuring because you're trying to change fibrotic tissue for normal tissue, and the protein that is keeping the fat in place, you're trying to make that normal again, shall we say, which is key in the structure. So we are restructuring, but we are doing so without increasing inflammation. Hence why we are using something to control inflammation at the same time. Whereas, you know, radiofrequency devices, polylactic acid, whatever else people use, they're not trying to restrict inflammation. Some of them are actually trying to create inflammation, and that's part of the problem. So why are you using inflammation as a tool to fight inflammation? It makes no sense.
I was taught to reduce the hypertrophic fat cells with injection lipolysis. That was my training on cellulite.
Right, okay, interesting.
So,
I mean, the hypertrophy in the fat cells does exist, and this is part of the pathophysiology of cellulite production. However, you know, where does the fat come from? Right? And that's why education is part of the treatment, not just the injections. But at the same time, we have to understand that, you know, there's something causing the fat cell increase, and there are byproducts of that. If you get rid of the fat cells, the byproducts are still there, such as the inflammation, etc., etc. And so that's why this product, I believe, works better than lipolysis, because it's treating the entire thing at the same time. And if you are a clinician who's interested in root cause medicine, and you combine all of that with the nutrition, we said, then massively, you know, you're going to get rid of what they have, and you're going to stand the best chance of preventing it from coming back in the future as well.
We see different stages of cellulite, so 1 to 4 or 1 to 3, depending on the scale that you look at. So is it possible to treat it all stages with? Almost. So normal skin we would count as just grade 0, like, you know, this is grade 0 here. And then you have 1, 2, 3, which obviously get worse as you go along. Grade 4 is the worst in this particular scale. Grade 4 is where we have sclerosis, so the blood vessel is just gone. At that point, you can't really help the area, because for any function to occur, you need oxygen as a basic thing. You need to take away carbon dioxide, you need to take away urea, you need to bring nutrients to the area, etc., which people know. If you have sclerosis, that's now impossible. And so you will treat up to and including grade 3. Grade 4, at best, you are somehow going to have a minimal level of improvement, I would suggest. Okay. And how many treatments do you need in general?
Good question. I mean, I have seen situations where only 1 was needed.
Wow.
But then you're talking about lower down on that scale, and also in a smallish area. Once you start to go higher up the scale, very widespread area, very high volume of acidosis and acidity, shall we say, and inflammation, then you're going to go towards 3 or 4. So this is much more variable, because it depends on the level of cellulite in clinical presentation, and then you adjust it based on that.
And maybe also on the level of cooperation from the patient.
100%.
Yeah.
100%. You know, if a patient is willing to do those things in between sessions, like get a good massage, get a good level of sunshine, implement nutritional changes, yeah, they're most likely going to need less sessions, I would say.
Okay, very good. Anything else to consider when it comes to the treatment
I would
itself
suggest,
or
you
the
know,
product?
when it comes to cellulite, you have to pay more attention to the science of what's going on. The actual physical placement, that's probably the easiest in the range. Get a cannula, superficial as you can, and just spread it out. There's really nothing to it. It's understanding why it's working, so you do it the right way without other, you know, inflammatory treatments that you're trying to do alongside to help, but it's hindering, as well as understanding, you know, the nutritional aspects of cellulite as well. If you do that, even if your technique is slightly wrong, you'll still actually help the patient very, very much. So my advice is, in the cellulite, pay very much attention to the science behind everything, because the technique is very, very simple.
Okay. Oh, perfect. Thank you very much.
Thank you.
Again, what learned. Schlechtes Englisch. Ja, vielen Dank an Dr. Epps.
Danke.
Für die ausführlichen Informationen rund um das Sunekos-Produkt Cell15. Wenn ihr noch Fragen habt, freuen wir uns jederzeit. Kommentiert gerne unterhalb des Videos und wir bemühen uns, euch ganz, ganz schnell mit Antworten zu dienen. Und wir freuen uns, wenn ihr das nächste Mal wieder mit dabei seid. Dankeschön.